Hi. Yes, good afternoon to all our friends online. So I'm Dr. Goh Huck. I'm the consultant nephrologist and physician. Nephrologist means I'm taking care of the kidney. Physicians means we are taking care of the general medical problems, example diabetic, hypertension, and all the rest. Yeah. So today we are here to share with you about the kidneys problems. All right. So let's for the next 30 minutes or so, we are going to. I'll spend probably 20 minutes to talk about this topic, and then at the end of it, we'll spend some time so that any of you interested to ask any question, we can have a lively question and answer session. So let's start with this topic now. Okay. So first, your kidney and you. All right. First issue is what are the kidneys for? All right. As we know, in the healthy people like you and me, we got two kidneys. Yeah, two kidneys, one on the right side, one on the left side, and each with 1 million this little filtering unit inside. These units are called glomerulus, okay, the so-called filtering unit of the kidney. We got each side 1 million of it. And these two kidneys in our body actually carry out a lot of functions. Kidney is one of the very important organs in the body. It carry out a lot of functions, and of the most important, there are four most important functions that are listed here in the slide here. Now, the first one, the most important one, is the kidneys help us to excrete the toxins from our body. As you know, every single second, even when we are sleeping, our body, due to the metabolism, actually is produce a lot of this dirty substance, so-called toxins, and also depend on type of food that you take. Especially those rich in meat and all this, we produce a lot of toxins. So these toxins are called so-called the kidney toxin, the uremic toxins, are being excreted from our body by the kidney. So whenever our kidney is not functioning that well, or even worse still, totally fail, this toxin will accumulate in our body, this uremic toxin, and then produce a lot of problems, uremic problems. All right. So this is number one. And then number two, the important function of the kidney is to regulate, excrete or retain water. Normal people, when we drink too much of water, the excessive water will be excreted from our body by producing more urine. All right. And when we have not enough water intake or restricted water intake, what the kidneys do, basically, they concentrate the urine now, so that with the little amount of water of urine, their body is still able to excrete all the toxins. Okay, and that's when we produce very concentrated, very yellow or very concentrated colored urine. Right. So kidney is very important in that sense because it regulates the water. So when the kidney fail, then we have to take care of this. In the patient with, if someone with kidney failures and they take too much of water, the water cannot be excreted and the water will accumulate in the body, go to the legs there, causing swelling of the leg, or even worse still, it all flush into the lungs and causing a condition called the wet lung, pulmonary edema, and end up cannot breathe, and it can be potentially life-threatening. And then the third major functions of the kidney is to produce a substance called erythropoietin. All right. Now, what is this erythropoietin? Basically, what happened is in our kidney, when the blood go to the kidney got this special sensors type of cells which can detect whether our body oxygen carrying capacity of the blood is enough or not. All right. If these cells sense that our body is lack of oxygen, then what happens? This cell will produce a special hormone called erythropoietin, and this erythropoietin will be carried to the bone marrow, whole body bone marrow, and produce red blood cells, so that it can overcome these oxygen carrying problems. So in normal people, that's how it is. Keep the hemoglobin level check and balance. Whereas if we have kidney failure, so this function is impaired, and as such erythropoietin level will drop. And patient with kidney failure will definitely have anemia, lack of red blood cell hemoglobin low, and produce a lot of symptoms related to the anemia, like breathless, lost appetite, very tired, sleepy, and everything. And the fourth important function of the kidneys is regulate electrolytes in our body. Now, as you know, our inside our blood, inside our body, inside the cell, outside the cell, inside the blood vessel, outside the blood vessels, is all full of electrolytes with various very important function. So which is the organ that regulate all these electrolytes so that they are in certain concentration. We call it physiological range, not too high, not too low. Okay, so these the major organs involved is our kidneys. Okay, so now there are many electrolytes involved, so I just pick four to explain to you. Number one, the most important one is sodium. Okay, sodium or natrium. Sodium is very important. High sodium, low sodium, both can cause serious problem. Includes things like fits, coma, unconscious, and all these things. All right. So sodium is very important. And this the primary organ involved in the regulation of sodium concentration is our kidney. And the second one, very important, is potassium or kalium, K plus. Potassium is very important because if the potassium is low or high, it can cause the heart to stop immediately. All right. So it's very, very important. And kidney is the major organ involved, all right, in regulating this. And the third one is definitely our calcium. All right. Because as we know, our kidney actually produce, not to say produce, but actually it activate the vitamin D. Okay, you and me, we take food that rich in vitamin D and all this, good, we go into the body. We are exposed to sunlight, good, because our skin can produce vitamin D. But all this vitamin D, either from food or from the skin, are not active, cannot be used by our body because it must be sent to the kidney to be activated. Okay, so our kidney actually activate the vitamin D that we get from the skin and we get from the food. All right. So if our kidney is not functioning well, whatever vitamin, whatever food that you get, the natural vitamin D and all this, and the sunlight, okay, that but your vitamin D is not usable in the body. So in that sense, when the vitamin D drop, it causes a lot of problem, include drop of calcium. All right. And another thing is also phosphate. So when the calcium and phosphate, these two electrolytes are being disturbed in our body, they actually lead to serious consequences. The most important thing like cramps, our heart rhythm will go haywire, and also it actually causes hardening of our vessels to the blood vessels to the heart. So end up heart attack and all this, hardening of the vessels to the brain, end up strokes and all this, and also hardening to the vessels to the legs, so that the leg become ischemic, not enough blood supply, end up gangrene, become black and need to be amputated, cut off, and all this. All right, all these are actually related to the normal kidney function. So as you can see here, kidney is very, very important. Okay, so next we proceed to the next issue is, yep, what causes kidney failure? All right, so what are the major reasons why the kidney fail? All right, in the different part of the world, they can have different reasons because of the different location and culture and everything. But in Malaysia, these are the few very important common causes. First of all, definitely top of the list is diabetes mellitus. Okay, as we know, okay, let me put it this way. Okay, of all the diabetic patients, if they survive long enough, finally almost all of them will have some form of kidney problems. Okay, I repeat again. Of all the diabetic patients, okay, if they survive long enough, okay, long enough means 8 years, 15 years, almost all of them will end up some form of kidney failure. All right, whether it's severe or mild. The other side, okay, of all the patients with kidney failure, all right, of all the patients with kidney failure, at least more than half of them are due to diabetic. Okay, you got me? All right. So the latest statistic from Malaysia, the Kidney Society, is that of 100 patient, of every 100 patient that started to go into dialysis, 61 of them, the kidney failure is due to diabetes. Okay, so as you can see, diabetes is a major contributor to kidney failure in Malaysia. In fact, that's the bad number one. We are actually one of the top of the whole world in terms of percentage of how many kidney failure patients are due to diabetes. 61% is actually one of the top in the whole world. Okay. And number two, the second reason is a high blood pressure. Now, this is also another very tricky condition where if you got high blood pressure and not controlled well, what you do? It will cause the vessels to harden and then restrict the blood flow. All right. And then that will lead to failure of a lot of organs in the body, include the kidneys. All right. And once the high blood pressure cause kidney to fail, it will set up a vicious cycle where the failing kidney will cause the blood pressure to go higher. And when the blood pressure go higher, the kidney become worse. Then the kidney become worse, the pressure become higher, and then it become worse and worse and worse and worse, and finally it will just explode. Okay, either end up with stroke or heart attack or dialysis. All right. And then the next thing is kidney stones. As you know, like you and me in Malaysia, we are enjoying very good food, all right? And our weather is actually quite hot. We sweat a lot. And sometimes we are running around very busy. We got no time to drink water, go to toilet and all this. So we actually not enough water intake. We sweat a lot because of hot weather. And then our food are really good, exotic food with a lot of salt, spices, and all these things. All these put together actually is a good formula to create kidney stones. All right. So a lot of us actually with kidney stones without we knowing. All right. And with the kidney stones accumulating, it actually cause a lot of obstruction and destruction to the kidney and end up kidney failures. And then the fourth one is also very famous in this part of the world is painkiller. All right. Yeah, our patient, especially those when the age catching up, we tends to have a lot of ache and pain here and there. We call it long chong tia, everywhere pain. All right. So when we got pain and all this, we usually don't actually go and see doctors. A lot of us very smart. We go and buy the OTC over the counter. We go to the pharmacy or the wherever to buy the medicine. They got all sort of painkillers. And all these painkillers are effective in killing the pain, but it's also effective to kill you in the long term. All right. So what it do is it will destroy the kidney and destroy many other parts in the body. All right. So be careful with painkillers. A lot of patients have kidney failure because of painkillers. Okay. All right, and then the next group is autoimmune diseases. What does it mean by autoimmune? Auto means ourself, immune means our immunoglobulin. So basically, it means our own body antibody attack against our own body. All right, as we know, antibody inside our blood is supposed to act when it see the foreign stuff coming in, like bacteria, virus, then it attack. But sometimes our immune system can go haywire, so it attack our own body. It cannot differentiate whether this is foreign or our own, so it attack our own body. Typical example would be things like IgA nephropathy, where a special type of immunoglobulin in our body, antibody, is called IgA. It attack our own kidney, all right? And other things like SLE, which is quite common in a young lady, all right, especially young lady. SLE, systemic lupus erythematosus, Hong Pan Lang Chang Zhen, SLE. So where a lot of antibodies actually go and attack the kidney, and a lot of patients, if not treated early, will end up kidney failure and need dialysis. Okay. And definitely there are also many other causes, especially others with like polycystic kidney disease. I'm sure some of you have heard about this. Polycystic kidney disease means poly means a lot, cystic means a lot of cysts. Polycystic kidney disease, a kidney disease where you got a lot of cysts in the kidney, not the usual 1-2 cysts. This is where it is inherited, congenital. You are born with it. Born with it. Either one of your parents, your father or mother have it and then pass it down to you. And the problem with this polycystic kidney disease is that you don't know when the baby is young, okay? And usually it takes about 20 or 30 years before you they start to develop cysts in the kidney. And once you start to develop, you have a lot of cysts, like whole bunch of grapes. The both kidney become whole bunch of grapes. And finally, it just occupy all the space, and the normal kidney tissue got no place to hold on and end up kidney failure. All right. So there are many others which beyond the scope of today's talk. Okay. Next, we proceed to how to detect kidney failure. All right. So this is a very interesting part that I always share with all my patients. My patients always tell me whenever I tell them that, hey, come on, Pakcik, buah pinggang tak bagus. They always tell me, oh, tapi doktor, saya tak ada kaki bengkak pun, saya tak ada gatal kulit pun, saya tak ada susah nafas pun, saya tak ada muntah pun. Yep, this Pakcik is correct and wrong. Okay. Correct, because all the symptoms that Pakcik say are actually correct. Okay, if we have kidney failure, these are the symptoms of kidney failure: leg swelling, breathless, itchiness of skin. Then we have disturbed sleep pattern. Daytime you want to sleep, nighttime you cannot sleep. These are all the symptoms of kidney failure. Correct. But this Pakcik also salah, also wrong, because if we depend on the symptom of kidney failure to develop to tell us that we maybe have kidney failure, and only then we come and see doctor, is too late. All right. Why I said so? Because generally we need the kidney function to drop at least 75%. Remember this 75, 75%, not left 75, but drop 75 means left 25%. Okay, before we have symptoms. So if you wait until leg swelling, then only you come and see doctor, say maybe I have kidney failure. Honestly, it's too late already. Doctor will tell you, Pakcik, mungkin sudah mau cuci darah. Okay, dialysis. So which means how to detect kidney failure symptom? Can or not? Can, but it's too late. Don't depend on that. So the better one will depend on the blood test. All right. Now blood test, especially a reading called creatinine. There are many other new reading, but the most widely used is creatinine. Now creatinine, if you check the blood creatinine go high, then you know that you probably have some form of kidney failure. All right, kidney problem. But also the bad news is, I must tell you that for the creatinine to go up, at least 50% of the kidney function gone already. So which means if you got 80% of kidney function left, 70% of kidney function left, 60% of kidney function left, you go and check blood, your blood test will still be normal. Creatinine is still normal. You need to drop to at least 50% and more. Only then the creatinine start to go up. So which means checking creatinine is definitely better than waiting for the leg to swell, but it's also not good enough. All right. So there's another reading in the blood test. They will do some mathematical calculation and tell you what's the GFR, glomerular filtration rate. In short, we say GFR. That's actually measure how good our kidney filtering the blood. That's GFR. That is more accurate compared to creatinine. All right. So I take into consideration your height, your body weight, your age, female or male, and all these things, and then it tells you a reading called GFR. So this one is good because it know our kidney function whether have problems or not earlier than the creatinine. But the most important thing is still the third one, the urine test, as I put on the slide. Because if we have any form of kidney problem, almost always we can detect something abnormal in the urine test, even right from the start. And the most common one usually is leaking of protein in the urine. Okay, if we go and pass urine and you noted your urine suddenly become very bubbly, a lot of bubbles. Okay, yeah, then you better be careful. All right, it's normal to have a few bubbles, but if suddenly become a lot, then you better come and check. Okay, that is the most sensitive test to know whether we got kidney failure or not. So I'd like to illustrate myself what I've said just now, a few important magic figures. If we wait until your leg swelling and all the rest of the symptom to develop, at least 75% of kidney function gone already, too late. If you wait for your creatinine to go up, at least 50% gone. Okay, so the most important thing is GFR and the urine test. And if you put everything together, symptom, blood test, urine test, and get a doctor to ask you question and examine you and do blood test, everything together, then it becomes very reliable. All right. Okay. So next we see. Okay, this is how to reverse or retard kidney failure. So which means now we are talking about if somebody already developed kidney problems, how do we stop it, bring it back to normal, or bring it so that it won't deteriorate so fast. Number one, we have to treat or control the cause, obviously. If the kidney failure is due to diabetes, you have to control your diabetes. If it's due to high blood pressure, you need to control your high blood pressure. If it's due to stone inside obstructing your kidney, definitely. All right, we understand. The most effective way of doing is remove the kidney. Remove the kidney. Okay, remove the stone. Okay, all right. So these are how it is. And if you do it early, fast enough, efficient enough, you may even manage to reverse, means bring it back to normal. But if it's a bit late, at least we can cause it to retard, means it won't progress so fast. And the second thing is kidney protective medications. Nowadays we got quite a numbers of medicine that can actually reverse or retard the kidney failure. Things like ACE inhibitors, ARB, and in certain other conditions of kidney failure, we can use omega-3, we can use steroids, immunosuppressant, and all these things. But please, not one medicine suit all conditions. So we need to, kidney failure is kidney failure, but it can due to various different causes. And different cause will need different medication. So you need a nephrologist to help you in this. Okay. And the next thing is diet control. All right. Okay. So if in somebody who are already with kidney problems, the diet is very important. The exact prescription of a diet, you need the dietitians and the doctor to help you. But here, generally, what I want to tell in basic principle is somebody with kidney failure, you're not supposed to, under most of the condition, you're not supposed to take too salty food. You're not supposed to take too high protein. All right, means you have to avoid, especially things like red meat, too much of seafood, internal organ, and Malaysian favorite durians, and also very important, many other things, especially things like associated with uric acid and all this. If the underlying cause is due to uric acid, stones, and all this. Okay, the number four is avoid further insults. Very important. I see patient with kidney failure still taking painkiller. You are killing yourself, all right? Unnecessary painkillers, okay? Or some still smoking. You're actually not helping yourselves, okay? These are all that further insults. Or you still take a lot of processed food with a lot of unnecessary chemicals inside and all this. You actually overburden your kidney, all right? Okay, let's proceed to the next one. Okay, what to do in stage 5 kidney failure. All right, let me explain first what is this stage 5 kidney failure. Basically, we grade the kidney failure according to a system, as what I said just now, the GFR, the measurements of how good the kidney function is. Okay, so in simple terms, okay, if anything more than 90, the GFR is 90 and above, we call stage 1. 90 to 60 is stage 2, 60 to 30 is stage 3, 30 to 15 is stage 4. Anything below 15, less than 15 is called stage 5 at the last stage. So the another name, scary name, okay, for stage 5 kidney failure is end stage kidney failure. End stage doesn't mean you're going to die, okay? Doesn't mean the patient is going to die. End stage means the kidney cannot function adequately to keep the patient alive anymore, and they need dialysis support. That's what end stage means. So when they have stage 5 kidney failure, and especially if already developed symptom, leg swelling, breathless, itchiness, vomiting, talking nonsense and all this, then the options we have, what can we do? Basically listed here. Number one, hemodialysis. Hemo means blood, dialysis with the blood. Basically what we do, we just poke the needle into the hand, take the blood out through the dialysis machine, cleanse it, and then put it back. Okay. All right. This is hemodialysis. Usually 3 times a week, and each time at least 4 hours lifelong. That's hemodialysis. Another one is called different type of dialysis called peritoneal dialysis. No, peritoneal is a name of the special cavity. Okay, cavity at the membrane inside our tummy. Okay. Yeah, so basically we put a small tube, a plastic tube, into the tummy itself. All right, one side in, one end inside, another side dangling outside like that. All right, so this tube we connect with another external tube and then put to the bag of special solution, and then we open the clip, the solution will flow inside to the tummy, and then basically it just absorb all the toxins from the blood After a few hours, unclamp, let the dirty substance come out. Together, extract some fluid, okay, and then let the new one go in. So this is called peritoneal dialysis. There are basically two forms to the peritoneal dialysis. I need to explain because actually we are some patients don't know such an options available. One is the 4 exchanges per day, means you put the bag, you do this exchange I said just now 4 times a day. Who do it? The patient do it themselves. Where? At home. Okay, every day without fail. This is called CAPD. CAPD. And then another one more chunky, a bit more advanced, is easier, where you got a special machine. We call it APD, automatic peritoneal dialysis. Nighttime before the patient sleep, just connect the tube in the tummy together with another tube, and then on the machine with all the fluid back on it, and then the machine will do everything. After 8 to 10 hours, when the patient wake up, just disconnect the tube and that's it. No need to do anything else. That is actually quite good. So that's called automatic peritoneal dialysis. And then the third option is definitely kidney transplantation. Means we get one kidney from another healthy living related donor, or healthy non-related donor, or another cadaveric donor. Cadaveric means somebody met with accident, brain death and all this, but the organs still functioning, and then legally we take out the organs and then donate it to patients in need. This is called kidney transplantation. And I'd like to share that now, Island Hospital, we are very glad to inform you that we are actually one of the very few private hospital in Malaysia that actually licensed to do kidney transplantation. All right. Okay. So these are all the options that are available in for stage 5 kidney failure. So, okay, this is probably the last slides. How to care for your kidneys. Okay, so how to care for your kidney, basically we can see your doctor for regular checkup, and then have a healthy blood pressure and all sorts of things. I already said just now all this. All right. Okay. And then okay, I suppose prevention is better than cure. Okay, so for us who not yet got kidney problems, how to take care of our kidney? Very important, as we can see here. We have to regularly have a check. Okay, and then we have to good blood pressures. Okay, and then if you need to take medicine, you must take it properly, especially if one is diabetic or hypertension. And also have to eat healthily. Eat healthily means you take more fruits, veg, and then not too much of processed food. Okay, and very important is also drinking a lot of water. All right. Now, what do you mean by drinking a lot of water? So enough water, how much is enough? That's the common question that people ask me. All right. So because we all sweat different amount of sweat, we do different type activities, all right, different body size, we drink different amount of water every day, so we don't know how to gauge this. Okay, so I tell you a simple clue is every time we go and pass urine, look at the color of your urine. Okay, if the urine is like chrysanthemum tea, okay, get water. All right, that's no good. Okay, so you need to drink more water. The normal urine should be colorless, clear and colorless. If you go and pass urine and then the urine color is like Chinese tea, that's even worse. Okay, all right, so these are the things. Okay, now we got some a little bit of time left behind for question and answering. Okay, I got a question from our one of our friend here, Jocelyn Tan. Okay, so he said what is the cost range for kidney transplantation? Who will get the source, the kidney? All right, I answer. Okay, good. So if we are talking about the in Island Hospital itself, okay, we can do the kidney transplantation, but the requirement of the Ministry of Health is that the source of the kidney must be living related. Means from your own family. Now, what is defined as own family? They got different categories and all this, but generally things first degree family, first degree cousins, all these are acceptable. Okay, no problem. If some patient ask me whether can we buy kidney and all this, or obviously all these are not allowed. Legally not correct, ethically not correct. Okay, now what is the cost for kidney transplantation. In Island Hospital, if I remember correctly, the numbers, okay, doctors are not good at numbers, okay, so you can always go to our website, all the information is there, but if I remember clearly, it's about 100 over 1,000 to 200 like that, okay, all right, so this is answer to our friend Jocelyn Tan. Thank you for the question, very good, okay. So any other questions from anyone else online? Let me see. Okay. Should we, okay, got some here. Let me see. Quite small, the readings. Okay. Who's this? Sharian, Sharin Lim. Can patient who is previously on CAPD switch to APD? Oh, sure. Why not? Yeah. Can the patient, Shalin Lim, want to ask whether patient already on the so-called manual 4 times a day CAPD, can they be converted to APD? Definitely, why not? Yeah, and after all, the tube is the same, all right? And yeah, the only thing is that it costs more, okay? It costs more because you need to get the whole machine at home, and no one actually buy the machine, no worry, okay, because if the machine go into trouble and all this, you need to repair and all this, then got no machine to use, okay, and the maintenance and then all these kind of problems, so actually the fluid company, usually the few big fluid company, they will include the machine as within the package for the patients, so which is very good, because if you got any problem the machine, they'll change one for you immediately, no need to wait, no need to do anything on your own, so the short answer is definitely can, why not, yeah, but it costs more, okay, yeah, and so you have to check that out, okay. So another, I suppose, is gentleman here, Kenji, say, doc, if uric acid raise will affect the serum or creatinine raise, okay, sure. The question is, if the uric acid is high, does it affect the urea and creatinine? Okay, it is not like A then B. It is not like that. High uric acid will cause problem, and this problem will lead to kidney failure, and then kidney failure will cause urea and creatinine to go high. Okay, so one aspect of the question will be, is high uric acid bad for kidney? Yes. Okay, but is high uric acid definitely straight directly cause high urea and creatinine? No. Okay, let me explain how does a high uric acid cause kidney failure. Okay, now when you got high uric acid, what will happen? The two most common important complication of high uric acid in our body is, number one, gout. Okay, we have joint pain. Okay, bad joint pain. Then when we have bad joint pain, we'll tend to go and take painkiller. And all these painkillers, if you use it regularly, it will cause kidney failure. All right, number one. Okay, number two, high uric acid can cause kidney stones. Okay, and when the stones form, it can obstruct our kidney, disturb our kidney, and cause the kidney function to drop, and that will cause raise urea and creatinine. Okay, so for our gentleman, Kenji, yeah, that is the answer. I hope I've answered your question. All right, any other that we have here? No, not at the moment. Okay, so time is oops, are we continue? Okay, I got some manager at the side here, no? She asked me to continue. Okay, so actually I'm enjoying the session. It's okay, we can keep on talking. All right. Okay, so next is yeah, we do have a few questions that we accumulated earlier. Okay, so that if you have time here, we can actually, I don't mind, you all stay online and we can talk about it. What are the symptoms of kidney failure? As I said just now, number one, you don't wait until symptom develop, because 75% of kidney function gone before the symptom develop. But if you want to know what is the symptom of kidney failure, as I said, number one, due to toxin accumulation, then you feel very tired. Okay, you feel very tired, you feel nauseated, no appetite to eat. Okay, you feel itchy the whole body. And then number two, because of fluid retention, then your leg have swelling, edema, you press down the leg, you got a little indentation, or the fluid accumulate in the lung, you start to feel breathless, all right? Especially if you lie down. Early stage, when we lie down, you feel breathless. You sit up, you feel better. That's the sign that water accumulating in the lungs. And then thirdly, all the electrolytes problems. You got low calcium, you got numbness, cramps, and all this. These are all the signs, can be the symptom of kidney failure. All right, and vitamin D, numbness, and all this. Okay, so and then, yep, there are many other symptoms. Symptoms of kidney failure is not very specific. It's not like heart attack. You got chest pain, you know heart attack. Okay, kidney failure, it can be tired, weak a bit, not as strong as previously. Then a lot of people say that, oh, this is due to overwork, not sleep enough, heaty, and all these things. So a lot of people tend to miss kidney failure if it depends on symptom. Okay, let's see what do we have earlier from the online. Okay, what health problem can people with kidney disease develop? Okay, basically it means if one got kidney problem, kidney being one of the major important organs in the body, if kidney fail, the body is a closed system. It cannot be one organ fail, the rest are okay. Once kidney fail, everything get affected, especially the heart. So much so that there's terms in medical world called renal cardio syndrome. Means if the kidney got problem, the heart also will have problems through various interaction, blood pressure, cholesterol, vessels problems, the anemia and everything. So if kidney got problem, the next thing heart will have problem. The next thing liver also have problems. Okay, and then after that, the whole body have problems. So basically, kidney failure is bad for the whole body, for all the organs. Okay, we got some more direct questions here. Okay, we got questions from Wai Ping Ho. All right, say, doctor, if a patient creatinine been consistent 157, did not get worse and have diabetic hypertension and done bypass before, what should we look further? Okay, basically it say that if a patient with diabetic hypertension and they got heart problem bypass done before, and now the creatinine has been consistent about 150, what should we do? Yes, the first thing is that well done. Okay, for a diabetic hypertension got heart bypass before, and then managed to keep the creatinine fairly stable for a while, I think is a good effort because it's not easy. Because from just by looking at the profile of the picture, diabetic hypertension, heart problem, even need bypass, means the score is not that good. So in this setting, the creatinine will almost always slowly going up. I cannot be maintained stable. So it's actually a lot of effort from the patient to keep it like that. I think it's a good effort in terms of effort, diabetic control, hypertension control, medications, and also diet and everything. Keep it up. What should we do further? Just continue whatever you're doing is enough. But please check with the doctor to make sure that already on whatever necessary medication to protect the kidney function, like what I said just now, the doctor will know to optimize the treatment for kidney, optimize the treatment for diabetic. The HbA1c, the so-called 3 months average blood sugar, must be below 6.6. Blood pressure must be below 130 over 80, or not more than 130 over 80. And then the medication to protect kidney must be on unless cannot be given due to certain condition, the doctor will know, and also take care of diet well, and then do regular control, and then avoid unnecessary things, especially painkiller, too much unnecessary herbs, supplements, and all these things. Okay, so I think good. Okay, so from our friend just now, good. Please keep it up, Mr. Ho, right? This one. Okay, now we got another one, Annabelle. Annabelle Anbalaginala, regular intake of supplements like vitamins, tablets, and or sincere health medications have any negative effect on kidney? Yes. I'm not here to critics about others, but if you ask me, okay, we split two sides. One is the so-called sincere and all the traditional medicine. Another one is all the herbs and vitamins. Okay, we go for the herbs and vitamins first. Herbs and vitamins got their effects, got their roles, but in certain type of patients. Okay, if you got certain condition where we cannot intake adequate type of vitamins or proteins or whatever it is, or we got some form of digestion problems, we cannot absorb certain type of vitamins or nutrition, or we got certain condition we're constantly losing some form of vitamins or nutrition, then yes, there's a good role for supplements, herbs, and vitamins. But in the normal people, otherwise normal, healthy people, that's actually whether all these supplements really help or not is very questionable. A lot of times it's probably you feel good after you take it. You feel like you have done something and all this. So I got no objection if healthy people want to take some supplements, but please not too much. I have seen patients who take supplement from all different brands. Each brand take the standard dose. So end up if you take 5 brands, you have already 5 times the limitations. I mean the recommendation, the daily recommendation, which is bad. Okay, let me give you a few examples. Number one, like vitamin C, good, good, very good. But if you take too much of vitamin C, you will end up having kidney stone. Okay, and that can cause kidney failure. All right. That's number one. Okay. Number two, calcium. Is it good? Good. But if you take too much of calcium, you end up calcium stone in the kidney. All right. And you end up calcification of your blood vessels, stroke, heart attack, and all these things. Vitamin D, is it good? Good. Same thing. If you take too much of vitamin D, you end up kidney stones. All right. So you see, yeah, okay. Even the good thing, if too much is no good. All right. And then the second question is about traditional medications, Sinsay or whatever it is, or the jamu or the whatever it is. Okay. All this, honestly, I'm in no position to condemn about others, but the only problem I face is I can see is that a lot of this traditional medicine not being regulated properly. It may have good constituent inside, okay, but it probably added with something else which is not regulated like the so-called conventional medication that we are on. Because like if you go and see any other so-called conventional medications, doctors, then they prescribe you a medicine, will tell you exactly what is this medicine, what does it contain, what are the usual side effects, what can it cause, okay? And you go and Google, you can find it. But if you're talking about traditional medicine and all this, sometimes we don't know what it is. It just tell you what this from what herbs and what plants and all this, but what does that translate into the factors inside that can affect our health? What are the potential thing to look out for? We don't know. To make it worse, we have this in every field we have, but especially when the field is not being regulated properly, you can have people who are not responsible. They want to have an immediate effect on their customer. So they probably add some painkiller, they probably add some steroids, and after you take, you feel very good. I'm not saying that all traditional medicine like that. I'm saying some. Every field we have this sort of people, and then that is bad. And there's no way we can regulate and check on it. So if you ask me, I myself do not encourage people to take any medicine, whether it's conventional, whether it's traditional, whether it's from grandmother or whatever, if you don't know what is inside. All right. Okay. Yeah. So that's my answer to that. Okay, like William. Okay, we got William Tenggadi. Tenggadi. Sounds like from Indonesia. Very good. Okay. If Indonesia, then selamat sore ya Pak. Ya. Health screening dan cancer screening dimulai umur berapa? Kalau mau umur panjang, apakah harus pegang satu doktor di Malaysia? Supaya rutin kontrol apakah minum suplemen ubat tradisional Cina merosakkan ginjal. So the last part of it, okay, I think probably most of us can understand bahasa also. So now allow me to use bahasa, so easier to communicate with our friends from probably Indonesia ya. So Bapak ya, tentang soalan dari Bapak William Tunggati ini tentang apakah minuman suplemen dan obat tradisional Cina merosakkan ginjal. Tadi saya sudah cerita bahawa saya tidak kritik suplemen dan ubat tradisional, tetapi masalahnya suplemen-suplemen kalau kita guna keterlaluan dia akan merosakkan badan kita ya, terutamanya macam vitamin C, kalsium, vitamin D, semua ini bisa menyebabkan ginjal berbatu, batu karang masalah ya. Jadi jangan keterlaluan. Kalau kita tak ada kondisi-kondisi medis yang special, maksudnya tak ada malnutrition, tak ada malnutrition, tak ada malabsorption, tak ada masalah menyerap dan sebagainya, tidak perlu makan suplemen dengan banyak lah ya. Yang kedua, ubat tradisional Cina sebenarnya ada yang bagus juga ya, tetapi masalahnya adakala mungkin regulasinya tidak cukup. Jadi mungkin ada komponen-komponen dalam yang bisa merosakkan badan termasuk ginjal, itu kita tak tahu. Jadi pandangan saya kalau mau minum apa-apa ubat, tak kisah ubat tradisional Cina ke, ubat tradisional Jawa ke, ubat Hindu ke, apapun, atau ubat doktor ke, sama. Kita harus tahu apa dalam komposisinya baru kita bisa ambil ya. Yang keduanya, health screening dan cancer screening mulai umur berapa? Health screening secara ringkas, secara umumnya kita beritahu pasien kita bahawanya umur 30 ke atas harus buat health screening setiap 2 tahun sekali. Ya, dan selepas umur 40 harus tiap-tiap tahun. Okey, lelaki dan perempuan semua sama ya. Tetapi itu secara rekomendasi umum ya. Ada orang yang ada family history tentang penyakit tertentu ya atau kondisi-kondisi tertentu, maksudnya perlu lagi awal ya. Untuk cancer screening pun sama ya, selalu general rekomendasinya selepas umur 30 atau 35 harus periksa setiap tahun. Okey. Nah, soalan terusnya, kalau mau umur panjang, apakah harus pegang satu doktor di Malaysia? Okey, ini memang satu komplimen kepada medical service di Malaysia ya. Okey, saya ingat soalan yang jawapan yang betul adalah kalau mau panjang umur, yang pentingnya mesti ada jaga kesihatan. Dan satu pada aspek jaga kesihatan adalah adanya satu orang doktor yang menjaga kesihatan bapa. Itu memang betul. Sama ada itu mesti di Malaysia kah? Kalau tanya saya cakap ya kerana saya di Malaysia. Tapi tidak semestinya ya. Selagi doktor itu ada responsible, bertanggungjawab, doktor yang bagus ya. Saya ingat bagus ya. Okay. So supaya rutin control. Ya, itulah jawapannya ya. Okay, yes, let's see. Oh, we have Johnny Cole. Hi doctor, is it normal to have foam in urine? Yes, as I said just now, anyone, if you go and pass urine and if you do in a rush and you strain a bit, the urine come out very fast, you will generate some bubble. That's normal. But if it is too much of bubble, what is too much? That's difficult to say. So for any individual here, if you think that your urine bubbling more than usual and you are worried, especially if it also come with other complaint, tired and all these things, or leg swelling, worse still, then you must quickly seek medical attention. Okay, but it's the difficult answer. But you must know that if got too much of bubble, is bad. Okay, it means protein leaking in the urine. Okay, now let's see any more. Here we have. Okay, Indah Pasaribu Indah. Okay, Dr. Goh, you are the best. You are the best. Okay, all right, thank you. Kidney doctor. Greeting from me who take care of Tan Ah Hong. We really. Oh, this is one of my very good patients helper. Dia memang jaga ini Bapak Tan Ah Hong dengan baik sekali ya. Terima kasih Indah Pasaribu. Terima kasih. Ya. Any other? Oh. Okey, kalau minum kopi dan teh, apakah merosak ginjal? Okey, dan bir juga. Oh, no. Okey. So, kita go one by one. Kopi dan teh, adakah merosakkan ginjal? Berita baik, tak ada masalah ya, kecuali kopi you tambah macam-macam lah ya, terlampau manis atau kopi yang tambah banyak spice, banyak salt, macam-macam ada orang ya, kopi macam itu tak bagus ya. Tapi kopi by itself secara sendiri, kopi itu tidak merosakkan ginjal, bisa, tapi haruslah sederhana ya. Dan juga teh pun tak ada masalah ya, teh pun tak ada masalah. Bagaimana yang bir? Okey, bir tak ada kesan direct kepada ginjal ya. Sikit bir dalam rekomendasi saya tak bantah. Walaupun saya sendiri tak minum langsung ya. Tapi saya tak bantah sikit, tapi dalam rekomendasi tidak melebihi apa yang patut ya. Bisa ya. Okey. Nampaknya Bapak William ini banyak meminum kopi, teh, bel, lagi ada. Ada lagi ubat sinsai, ada lagi macam-macam. Jadi jangan keterlaluan ya Bapak William. William Tunggati. Okey. Okey. Kita ada lagi soalan. Sampai dia pun senyum di tepi. Okey, mari kita tengok apa lagi ada. Tak ada? Okey, tak ada. So, the time, okey? Okay, good. So, yalah, ada had masanya juga ya. Saya berasa, I switch language now. Limitation of time. I really enjoy this session and chit-chatting with all our friends online. And I'm happy that you all are concerned about your health and during this time of the day where you are supposed to work and all this or do other things, sending kids and all this, you are here spending time with us. I'm very happy. So please, I hope all of you stay healthy and well during this COVID pandemic time. And I hope that yeah, we are here ready to serve you should any time anything that is required. Okay, saya berasa sangat syukur hari ini kerana dapat bersama dengan bapa-bapa, ibu-ibu semua, dan harap dalam masa pandemik ini semuanya berada dalam sihat-sihat dan sihat-sihat dan selamat ya saja ya. Dan bersama dengan ini diakhiri dengan kita punya semua ini greetings from Island Hospital. Harap semua selamat dan baik. Okay, so greeting from us, and thank you very much for your spending time listening to me. Thank you, and have a good day.